Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm very excited for today's guest. We have someone coming from us from what they say is across the pond. Dr. Pothalingam, say hello.
Hi, everyone. You can call me Menaca. Yes, my surname or family name, as you call it, is Pothalingam.
Yeah, so Menaca, I appreciate that, but I definitely want our audience to know that you're a dentist. Why don't you reassure us that you're a dentist and tell us, how did you get involved in dentistry? What made you become a dentist?
So I think when I was around 10 years old, and I think I had a lot to do with that from my dad. My dad's a doctor. So at 10 years, I remember I wrote, my ambition is to become a dentist. However, I'm from Sri Lanka, and I got caught up in the war and left the country and went to India, in Bangalore. That's where I did my dentistry and became a lecturer there. And then, as fate would have it, as many people, then got married and moved to the UK, did my qualifying exams, and I've been a dentist for 25 years and a practice owner for the past 15 years.
Wow, that's fantastic. You don't look even close to being old enough to...
I take it.
Time, and I don't mean that sarcastically. So you got into, you dentist, you have a practice, but you're also a speaker and a coach, and work with who do you work with mostly?
Healthcare professionals mainly. So
Okay.
Just to give a gist of the journey and why I do what I do. I went to India because of the war, and then I never studied English till I went to dental school or university. And then I had this big thing about my English not being good. So I was a trainer, I was a lecturer, and I was a practice owner, but I still had that hiccup. And unfortunately, for many reasons, a few years back, I was signed off with depression and burnout. And that's when I started exploring myself. I wrote my book, published, and then I felt I'm not alone who is in this point of, we think we are invincible. And particularly as healthcare professionals, we put ourselves at the rock bottom. We want to serve our patients. We want to be there for the family to provide, but we never look after ourselves. And I smile all the time when I say smile is great, provided you don't use it as a mask to hide your pain. And because people don't identify it, and you don't get the help you really deserve and need. So that's the reason I started to do the training with my personal experience. If I can even help one person not go through what I went through, that would be really helpful.
And terrific attitude and outlook, and certainly helping other people is a great way to invest in ourselves too, right? So I appreciate that and love what you're doing. Let me ask you, what are some challenges and problems that you see dentists facing today that they haven't before? And of course, international problems, right? Not just problems in England, but worldwide. What are some issues that you see that the dentists are coming to you for?
So mainly, I think it is well-being. We are told from as very early on, I think a certain type of people generally go into certain careers, and we are kind of perfectionists. We want to do it, and then the profession teaches us, or even in universities or dental schools, we are taught the more the letters we have at the back, it's better. The more you perform, it's better. So it's never enough. You are never enough, and you judge yourself so much more than anybody else judges you. You are told that, you cannot fail. And life that doesn't work like that. You will have failures, you will fall, and you cannot keep adding in. And it all comes from a place of lack, at least it did for me, because I think not, as I mentioned before, not studying English or being the oldest kid in the university because I had to discontinue and start again, and or coming to the UK and you're not from the home ground. All that experiences kind of made me think I'm just not enough. My way of coping with it was to do a course junkie, just one course after the other. And
Sure.
you think that is the way you are going to have success. However, what I found out is if you are not having personal satisfaction or happiness, it is questionable whether you will be able to attain success. But even if you do, you can definitely not be able to sustain it for sure. And I think most of the dentists or doctors or even nurses who have worked with me, even management people who have worked with me, and I think that's the main thing. All those people are very smart, very successful in their professions, but are they happy? Perhaps not so much. Or they fulfilled because they came to this profession to help other people, but we are not encouraged to help ourselves and look after ourselves at the same time, and I think that's a huge issue.
Sure. So, you said it, and we know that dentists take care of people every day. They take care of their patients, their team members, their family, their children, their parents, on and on and on. So somebody wants to start taking care of themselves first, right? And they want to put themselves first today so that they can be better for those other people, right? It is actually, I think, very selfless to put yourself first often, especially with the right heart. What are 3 or 4 steps that someone can take today to start to overcome some of these feelings and to kind of get themselves on a healthy track?
So I call it the SMILE system because I am known for my smile, and my practice is called the SMILE. My company for training is called Smile Leadership Academy. So for me, first one is about self-awareness or self-assessment. It's about identifying your reputation, what you think of yourself first. 360 assessment we do for the business all the time, how other people see you. And I think usually there's a discrepancy, and how people see you are much better than how you see yourself. And second bit is, I think, self-satisfaction. It is important to use that methodology. Sometimes it's known as coaching wheel, to know where you are, in which area. Exactly tell, it's like 4 tires you have in the car. And if one tire is punctured and you're going with the 3 tires, you can't go too far. So it's really important to assess that situation. And then also acknowledge your dreams and goals, and it's okay to have your own dreams. It's okay to have your aspirations, but and also resources and gifts, because we normally see when it's resources, we always talk about business or profession, but we have our own resources, our experiences, what we have learned. We have so much, but are we tapping into them, and are we identifying them and using them? And the last one is like ecosystem, isn't it? Jim Rohn beautifully says, you are the average of 5 people you're surrounding yourself with.
Right.
Are you in the right crowd for that? And then, of course, the motivation and micro magic magnets, I call them, the micro habits every day, what you do. For me, what helps is the meditation, mindfulness. Mindfulness suits me so much more, meditation, because I'm a chatterbox. I find it really hard to sit for a long time. But mindfulness is just be present. When I'm talking to you right now, I'm not thinking or doing anything else. I'm not thinking about anything else. I'm being present and giving my best at this moment for this podcast. And that's mindfulness. And so it's easy to do. And then, of course, inscription or journaling. It is a life changer for me. So I write every day 5 things, or at minimum 3 things, what I'm grateful for, how did the day go, and what I can do better, and then reflect it. I call my navigation system, because if without reflection, you can't do better or worse next day. So you need to reflect. And the direction. Every day, you need to think at least one thing. What is so important for you in that one day. So this morning when I woke up, last night actually, I wrote, hopefully I will be doing my best and give my best to this podcast, and that was it. So that kind of helped me. So as soon as I walked in, I told my receptionist, 5 o'clock, you have to catch up, because I have to go for this podcast. I have to get ready, mentally ready. So I think that's what it is. And then, of course, Then inspirations, who is your inspiration? What is your experiences so far? What are your limitations or stumbling blocks you have within yourself? And who is, who you can look up, who you can go for help? It could be a coach or mentor or someone you admire. Just keep those people ready so it will help. Then I think it's about leadership, isn't it? Leading yourself. Affirmations really help for me. I know it's a bit woo-woo, particularly the scientific lot of as dentist, but it helps me. So I'm going to tell. You don't have to tell a big thing. Just say I am enough, or what is your story? Just accept it and have an unconditional love. You always have unconditional love for your children, your loved ones, but are you showing that for yourself? Gratitude. And the last one for me is expansion of possibilities and elevating the progress. Basically, what I'm trying to say is always ask for help. Have accountability and never have a limitation where how much you can grow. In 2019, I got an award in the UK Parliament. Of course, I was over the moon, which I never dreamt it would happen. But more than that, for me, even when I wrote the book, it is about a small town girl who didn't speak in English, had to move 3 countries, migrated. I ticked off the 3Ds, the death, the divorce, and the depression. If I can make it, I want other people to look at it and think, oh, if she can do it, we can all do it. I think so. I think these are the things for me, really.
That's great advice. And I agree with everything that you said, by the way. And I will want to add a little bit, though, that these things take practice to get good at, right? So let me talk about mindfulness a little bit. It's something that I struggle with, and I try to, right? And I say, hey, I'm going to meditate, right? And I know that meditation is a really good way to practice mindfulness. Being disciplined to meditate is so hard. Like I can go a day without eating. I can work out 6 days a week, but to actually say, hey, twice a day, I'm going to unplug for 15 minutes and do absolutely nothing, but meditate. It's hard to do. So what is a baby step? What is one little baby step do you think that someone can do to maybe start meditating or maybe start practicing gratitude and that sort of thing?
Yeah. So that's really an interesting question, because I was the same. My dad did meditation, yoga for a long, long time. And I used to think, what a waste of time. Sitting and doing nothing. I could do so much in this time. Being, honest and candid. But I realized actually by doing less, you can do more. But I think how I started is my dad taught me a bit, and then I went and did my mindfulness course. So a couple of things I can tell is, if you put a candle, a flame, because the objects really help, looking at it and don't think, might be focus what kind of shape it is, what kind of feeling it's evoking. So it kind of helps. And I prefer mindfulness to meditation because I think it's much more forgiving and accepting. Because you are taught, if the thoughts come, it's okay. You think, thank you so much for those thoughts, and park them aside, and you can go back to where you were. So for me, it works. Or even if you're just going for a walk, just see how your feet are touching the ground, or how birds are chirping, how the trees are feeling, how the breezes fall. It's not difficult. So those tiny things. And I think the main thing I found it really difficult is when I'm talking to someone, I thought being present and being mindful means I'm not showing up for you. That was big, because as healthcare professional, we are taught, listen.
Sure.
But actually, when you are present within yourself, at least hold the 10% and be quiet. Actually, that helps you listen more actively. So I think they are the small tips. And gratitude, it is amazing, because I am not a person who always did the gratitude exercise. But when I started, I have to write the 3 things every single day. And then I started picking up, you know what? This is going to go into my diary. Or this is going to be good. And obviously, that particular moment, your immediately mood switches, because you're already appreciated that moment or appreciated someone.
Right.
It doesn't have to be a big thing, isn't it? Somebody smiling at you, they can say your hair is looking good, anything, or bring a cup of coffee, or we always, and in the UK, having a sun, seeing the sun itself is, we have to, oh wow, that's great. Today is so sunny. So I think small things like that.
Brilliant. I want to thank you very much for coming on here. And I want to encourage our audience to check out your book. Where can they find it?
Resilience Learned, it's called. Healing My Wounds and Finding My Wings. It's on Amazon.
Amazon, great. I want to encourage our audience to check it out. And Dr. Pothalingam, I want to thank you very much for coming on today. I appreciate you taking the time and hope you have a wonderful evening and know how grateful we are for you.
Thank you so much. Really appreciate it. And thank you so much for your audience as well. And it's a great show. So keep supporting and keep growing. And I think, as they say, alone we can go faster. Together we go further. So hopefully you're doing a great job. And thank you so much. It's a privilege to be here.
Thank you.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.